What's up, banana bunch? Bunch? Bunch?
Welcome to the Junglejims podcast.
What's up, Banana Bunch? You know what time it is. It's time for another episode of the Junglejims podcast. I'm your host, Mark. Welcome to the show. Look, I'm over here right now hanging out by the Campbell's soup can because, well, it's iconic. It was a great place that I could set up my camera easily. And I always like coming out in the store. Let me get through the clerical stuff off the top here. We got some great episodes coming up. First off, get your tickets to Sandwiches of History. We're bringing in Barry from Sandwiches of History to the Oscar Event Center on March 9th. Tickets are available now. You can get them at sandwichesofhistory.com/live or get the link available on junglejims.com. Follow Junglejims on Eventbrite because we'll post all of there, same thing. Tickets start at $25. I am the special guest, so I'm going to be helping him make a sandwich for the show. Really looking forward to it. Oh, the Campbell soup is awesome. Yeah. I bet you can't hear him, though, because I'm wearing the good mic today. Anyway, love him. He's sipping and a slurping. Anyway, Sandwiches of History is coming up on the 24th, which is this coming month. If you're watching the show as of the release day, we've got Braun Strowman coming in here. He's doing a signing event for Real American Beer, and then he's in town for WWE Raw that same night. So you can come here, meet him. I think you have to buy a case of beer. As I understand it so far, you're buying a case of beer. We have some giveaways coming up, too, that you can find out all about day of the show. I think they're giving away a wrestling belt. I think they're also giving away tickets to Raw, so maybe you want to come out to that. Yeah, those are the big ones. Download the Junglejims app. You can get exclusive app deals on there. And maybe more importantly, you can see the weekly ad. You thought I was going to say watch the podcast. Oh, yeah, you can watch the 5 most recent episodes of the podcast that way, too. I thought that was really cool. All right, well, I wanted to get that out of the way because this episode's kind of a serious one, right? I'm a funny person, but I obviously have a little depth to me, too, a little dimension here and there. And I think it's important that we cover all these kinds of things, especially with the way the world seems to be now, right? So mental health, that's a huge topic of conversation. It's only due to my good mental health that I'm able to honestly come out here and easily perform for all of you so frequently to keep that good enthusiasm, that energy. There's a lot that goes into it in both my personal diet from like a food end to a more emotional diet as far as like I like, this movement in beverages lately with adaptogens and other things to make you feel good. I've been really enjoying that. That's a space. You're seeing that, those kinds of same things with things like CBD. Now, I'm no doctor, so I can't recommend all of these, but I'm just saying this is something I'm actively involved with, aware of. I love a therapist. You know what I mean? Like all that stuff. Now, I'll let Teresa tell you way more about the Ohio Council. She'll do a way better job of describing it, but she is the type of person that's out here leading that charge to make sure all of us are well enough to do everything that we need to do. There's no way to say this bigger, and I think anything else would be reductive. I mean, again, this is something that affects every single person that's alive all of the time. It affects your friends, your family, all of that stuff. And thankfully, we have groups like the Ohio Council who are out here making waves and making changes and strides to make sure that we're all taken care of in a better way. And we all, make it around. I'm trying not to tell you too much of my personal life and let you know how dramatically this has affected who I've become, how many people I've lost to this sort of thing. I don't want to put like a warning on here, but yeah, I mean, it can get real. So anyway, if this is a topic that you find at all sensitive to you, just maybe put your blinders up a little bit. So on that, let me turn it over. We'll try to be a little light in the way we describe this. So go ahead and you get to see Billy Sutherland again here, as well as Teresa Lampl from the Ohio Council.
Well, Billy Sutherland back in the studio. What's going on, Billy?
My man, Mark.
What have you been up to?
Brother, I don't know. Running hard. It's been a minute.
Yeah,
running
I was gonna
hard.
say, you and I are constantly coasting on some form of fumes, I think.
Yeah, we are.
That's
a good entree into what we're doing here.
Right? I thought so, too.
Yeah, so you planned that.
Maybe a little bit. It's 50% planning, 50%, I don't know, I got a couple drinks on the table.
Yeah, I can't wait to get into those drinks.
Yeah, me too. I'm excited too. Well, I guess I'll talk a little bit about the drinks, then I'll have you introduce our guest today. So I brought with me today a couple different brands. I brought the brand Recess. I brought the Illicit Elixirs. Got 2 new flavors in. And I saw this too. This is from Kin Euphorics. All functional beverages, no CBD, no THC, any of that stuff. They are hot on the adaptogens, which are for your brain to help maintain balance, for example. But that is part of the theme today. So Billy, why don't introduce our guest today, even though I'm pretending like I didn't meet her 5 minutes ago?
Well, that's going to be a lot easier than trying to understand what you just said.
Thank you.
You
Me
used
too.
About 12
I
different
honestly-
words I've never heard in my life.
You're just supposed to drink them. It's
we
fine.
got a special guest here today. Teresa Lampl is the CEO of the Ohio Council, and they play a key role here in Ohio to what's really epidemic, which is mental illness and depression, anxiety, and so she has been. Teresa, how long have you been running that organization?
I've been with the organization for 20 years, but I've been the CEO for 6.
Amazing.
Years,
So
yeah.
you've seen quite a bit in your time, I'm sure.
Yeah.
I might go so far as to say you've seen it all.
I'm going to write a book someday.
I bet you will.
And the title will be You Can't Make It Up.
Consider this my pre-order.
Okay.
So, Teresa, what exactly does the council do?
Sure. So the Ohio Council of Behavioral Health and Family Services Providers is our full, long, very difficult to say name, which is
It's
why we
not
go by
even
the Ohio
near
Council.
that.
Have
That's
they,
right.
have they shortened it to an acronym?
The Ohio
That's usually
Council.
right.
So we are a statewide trade and advocacy organization, and we represent the community behavioral health industry. So I have about 175 organizations who are private businesses across the state of Ohio that deliver mental health, substance use, family services, prevention, crisis care, all across the state of Ohio. So what we do is we represent them in making sure that public policy and rules and regulations allow them to be high quality businesses that actually focus on meeting people where they are and providing high quality behavioral health care.
That's
I mean,
amazing.
it's amazing the work the lifting that's being done, right?
Yeah.
So I looked up some stats,
Oh, this
and I got to know. Yeah, I know.
But they
This
were
should be
baseball
good.
stats or nothing.
Oh yeah. This guy.
I'm sorry. You get the two of us in the room. I'm like,
Yeah,
I promise I'll
sure.
take this seriously, but occasionally I have some jokes.
It's all good.
We're going to laugh our
We
way
have-
through.
we have-
Laughing has to be part of the remedy for much
Absolutely.
of what we're talking about.
I agree.
If you don't laugh, you cry.
So if I think I went back. I mean, I think the most recent I could find was 2023, but I read somewhere where almost 1 out of 4, 23 point some odd % of people have been diagnosed with a mental illness. Whoa. Is that right?
Yeah, so at any given time, 25% of the population, 1 in 4, is experiencing directly or indirectly a mental health or substance use condition. So when you think about it from a...
So that's both together.
Yeah. And when you think about it from a disease burden, I don't know of any other condition that's affecting 1 in 4, which if you think about it, it means every single family
Yeah.
is either
Yeah.
directly have someone in their family or is living near someone, that is experiencing a mental health or substance use crisis in need of care.
Sure.
So yeah, that's the
And that's
number.
just the diagnosed, right? Because I'm assuming there's obviously a little outlier.
Took the words out of my mouth. It's got to be twice that.
So we know that during COVID, those numbers jumped to about 40%. Because people were at home, we were dealing with isolation.
Sure,
we
40%
didn't know-
diagnosed.
So that's not a diagnosed number. Diagnosed is a different question because
Okay.
the biggest challenge is access.
Right.
So the challenge with access, and here's the numbers on that, because this is always like, well, I can't find care, or I can't get care. Well, it's because we don't have enough people caring for people. We have a workforce shortage, a workforce crisis, I would say.
Yeah.
So
It's hard,
adults,
Teresa.
absolutely. For an adult to get access to mental health care, about 50% can get care.
Okay.
For kids, it's about 44%. Wow. On the substance use side, it's 23%. So only 23% in need of care can actually access the services that they need.
And they can't access it.
There's several reasons. The biggest one is probably insurance coverage.
Sure.
Because we passed a federal law 13 years ago that said we would create parity so that med-surg conditions, medical conditions, when you go to the hospital, when you see a doctor for a physical health condition, that we will treat mental health and substance use, or what I like to call brain health, that we would treat brain health the same way we treat heart health or lung health
Sure.
or, prostate health. We can talk about prostates, but we can't talk about mental health.
It's crazy.
So
Can't talk about the thing that's driving all the other systems for some reason.
There
right.
you go.
Executive functioning, last time I checked, if the brain's not working, the rest of the body's not working.
Yeah.
So
It's the only organ that named itself,
Right.
I feel like it deserves a little time in the sun in this regard. I mean, I'm being serious. It's silly to think about, right? But
Kind of matters.
Yeah.
Kind of matters.
It's up there.
So I think, insurance access, and we know, I mean, there's national data, there's data for Ohio that says, primary care, which is not the panacea of payment for,
Right.
is not where you make a lot of money. Behavioral health providers get paid 20% less than primary care.
It's unbelievable.
So then the
And
challenge.
that's all dictated by state or federal?
Usually it's private market and what the insurance companies are willing to pay.
Oh, the plot thickens.
So the plot does thicken.
And then it's what other prior authorization, do you have to have prior authorization to get, treatment more than one time a week? Do they want you to only get a 45-minute session versus an hour session? So there's
Right.
lots of things that come into play that make it much more challenging. So what we've seen is then a lot of providers, clinicians, psychiatrists, nurse practitioners have started saying, we're not going to take insurance any longer.
Yeah.
And so they're paying, it's cash, it's become cash only.
Yeah.
And we're the only sector in the healthcare space where Medicaid is the preferred payer, because Medicaid has recognized the importance of treating the mind, because we know the data there, when you have a chronic health condition and a chronic mental health or substance use condition, your total cost of care is 5 times more if you don't treat the mental health condition.
So think about all of that.
Yeah.
That she just said.
A lot of stuff.
Okay, that's a lot of stuff. But a couple of things that jump to my mind that I'd love to get your thoughts on. First of all, it's touching every family.
Every family.
Yeah.
So, and I've said this to my kids, to anybody that'll listen, when they start talking about having anxiety or they're feeling sad, I'm like, everyone. It touches everyone. We all know somebody that is struggling with either anxiety or depression.
Sure.
And it's amazing to me, knowing that every family's touched, we still live in a society where if we don't have somebody like Teresa leading the Ohio Council to go out and advocate and say, this has to change, I would have no idea what those numbers might be, but they'd be a lot less.
Yeah.
44% for kids, maybe it's 20%. It's just hard to fathom.
Oh, yeah, absolutely.
Can't get it through. I don't understand it.
You're watching all these people struggle all the time now, right? And social media has sort of made it easy to see, I think, a little bit in some regards, right? Because it's a filter-free zone where you're here to express yourselves. So I'm always just fascinated by it because, well, I have that joke. You hear 1 in 4. I'm like, and if it's not, if you don't know anybody, it's you probably.
We're 3 for 3 right here.
But I was just going to say, I think
we're
I'm
three for sure.
impressed.
Absolutely.
Yeah.
We're really kind of tilting the numbers a little bit right now.
Yeah.
But no, I mean, all kidding aside, it is obviously this huge thing that's affecting so many people. I've watched it, both from the substance issues to just as simple as having things like intense anxiety or obsessive compulsive disorder, anything that could fall into that range. I'm watching it at the very least be an intense struggle for a lot of people I love. And in a lot of cases, be completely detrimental to them. And many of them are not in the financial space to be able to pay out of pocket to deal with this. And that's the crazy
Well,
part.
I would say most.
Right. Oh, yeah. And I mean,
think about one of the biggest stressors on people. It's financial, right?
for sure.
Well, and then if you think about, so we've also been doing some work because there's an economic cost to doing nothing,
Right.
what we're doing today.
Right.
And it's huge.
That's a great point.
$330 billion is what we lose in gross domestic product.
Wow.
And for an employer,
How
for
in the world do
every,
you even start measuring that?
yeah, right. And that's just depression and anxiety.
Right.
That's just
Oh,
that
wow.
alone. So,
And that's like an unfathomable number. A year, $330 billion. I'm like, that doesn't exist.
and if you
Right.
think about it, what it means, for a person who's experiencing it in the workplace, we know that if they have a serious mental illness, they're missing about 9 to almost 10 hours of work per week.
Mm-hmm.
And if it's a moderate or mild, it's still around 6.
Yeah.
And if you're the caregiver of somebody, if you're caregiving for somebody, it's 32 hours a week. That's a second job.
Right.
So that's the cost to the person. And then we wonder why presenteeism and absenteeism and the workplace costs. And so, there's the National Safety Council. Think about this. The National Safety Council has done a mental health calculator to calculate for employers on a per employee cost. What does it cost? What is the cost for your organization of mental health in your workplace? and it's around $7,800 per employee.
Wow.
In just healthcare costs and missed work, absenteeism, presenteeism.
That even sounds low to me.
And then,
healthcare.
but that's across every employee.
Right.
In an industry.
Yeah.
And so then if you add the turnover cost, you add another almost $5,600. So you're talking $14,000 a person.
Yeah.
Essentially.
Yeah.
That we're losing because we're not providing treatment, we're not providing access. And many times employers think they've done the right thing. They think they've, bought a plan that has a benefit, but they don't go the next layer deeper and say, well, what's your network really look like? And do you actually have people in your plan who are taking new patients?
Oh,
do you
yeah,
have people
right.
in your plan that are treating kids? Do they treat kids outside the school hours? Because that was what I ran into when I needed to get care for one of my kids.
I didn't even think about that. Yeah.
It's like, well, they're available, but I'm only in the office from 10 to 2 when my kids are in
Right.
in school.
Yeah.
Right.
On days that don't exist. You know what I mean?
So
Yeah, exactly.
it's do you have a benefit, but you have lots of reasons why you can't use it.
Yeah.
And then people are like, well, telehealth is great. Telehealth is a tool. It's an important tool.
Right.
But it still doesn't solve the shortage of people.
Right.
And that's the other thing. We think about the stigma of mental health and substance use. Well, the workforce is pretty stigmatized too.
Yeah.
And they're stigmatized, frankly, in what they're paid for. These are people delivering life-saving and life-changing care every single day. And we pay them less, an independently licensed, therapist who can diagnose and treat makes less than $70,000.
That's crazy.
I mean, it is, it's unfathomable to think about that. And, knowing some of the organizations that you work with, hearing you say that there's just a shortage is an understatement. I mean, I know of 2 different organizations that said they could add probably, there are a couple hundred, almost 300 people. They said they probably could add another 100 people. But it's hard work.
It's hard work.
You think about, so how does your organization, if at all, I don't know how you can only do so much, right? You're focused on policy and advocacy. But when you look, I think about it often. Being somebody I spent a year in an orphanage as a 10-year-old. I don't know if I ever told you that.
I think you told me the last time you came in here.
Did I?
It was
Well,
my
it must
Jungle
really
Gyms
be on my
exclusive.
mind.
I know.
Give me a couple of those.
Yeah, exactly. I'll start working through the drinks.
Yeah. But understanding the importance that they can play in a person's life at a specific point in time, the lifting that has to be done by those people is so difficult. Do you see potential solutions? I mean, when I think about it, I'm like, to be completely frank, I end up with faith. I'm like, if somebody is passionate about what they're doing because they're convicted, because of their faith, or really I should say any conviction, they're convicted. Like, this is what I want to do.
Following
I
that
watched
passion.
my brother go through this. I watched my sister go through this. I watched my, then maybe, but it's.
We all have a calling. I do firmly believe that. And a lot of the work that we do is a calling. But it's also recognizing that, it is healthcare. And do we recognize, the science and the treatment that we're trained to do? And do we recognize that many times we're first responders?
So you're saying it's coding?
Right.
So it's not just coding, but it's really raising the value. When I say to you that we provide life-changing and life-saving care, that's very different than what most people think.
Right.
They think you're the meaningful helper or the community visitor who's just there to offer moral support.
Right. Almost like a public version of you're just above a volunteer.
So I'll tell you a story about the challenge that you experience, and this is the devaluing of the work that we do. And this is, again, going back to COVID, when first responders and teachers,
and let me back up real quick. When you say devaluing, you're not talking about the Ohio Council and the advocacy work. You're talking about the people that you're serving.
The general public perception
Sure.
of what does a social worker, a mental health counselor, a case manager, a community worker, a peer provider, all of the folks who work with people, who do street outreach, who do
directly involved.
They're working in a crisis. Many times we're responding to very volatile situations.
I'm sure.
and we've had law enforcement officers who say, I'd never walk in there without backup, and and I have guns and weapons, and you're walking in with just you and a cell phone.
Yeah.
But I think the challenge is, when the general public, and during COVID, they were giving first responders and teachers and everybody, if you went to Starbucks, you got a free cup of coffee if you were a first responder. Show your badge, so you're a hospital worker. We had a person who went into their local Starbucks. They were standing in line with, the other folks, appropriately social distanced, and showed them the badge from the community mental health center. And they said, oh, we're not we could, thank you for doing God's work. We don't recognize that. That'll be $5.95.
Oh, that's crazy. And that.
So are we healthcare or not? It's back to, is it brain health? Is mental health essential health?
Where's that line?
And how do we elevate the value that it's just as important? Think about physical healthcare coming back to insurance. You get a well check. You get a physical checkup every year.
Yeah.
We don't get one for mental health.
Right.
So we're actually working to change that. We're trying to, so it's trying to, how do we get a mental health checkup? How do we get a checkup from the neck up, as I like to say?
I love it.
Because if you don't, if we don't reconnect the neck, and, the whole body is connected, and, we've got to be able to take care of that. And we've got to recognize the workforce that works in helping the brain. We can demonstrate through CAT scans and PET scans that you can do cognitive behavioral therapy, talk therapy, and it makes biological changes in the brain. And we're dealing with, biobehavioral conditions, but there's absolutely a biological component to every mental illness and every substance use condition. So how do we make sure we not just have medications that are, important,
Of course,
but do the other changes that help people live
There's
well.
other techniques and things like that. I mean, something I keep thinking about the whole time here. And by the way, I just poured one of the Illicit Elixirs. This is the debaucheberry to try. It's raspberry and blueberry. I think it's pretty good. Elixir, yeah.
Is that a new
I think that's
class?
Sounds
yeah,
bad.
right. It's funny for something that is supposed to be so well. I remember when I first heard about it, I was like, "That's an interesting name for this." I'm not mad about it. I love it, and they use and I always forget this character's name, but I grew up in the near the New Jersey boardwalk, and I think it was Millie is his name. But this is like a famous logo on the beach, and I remember when I saw the cans, I was like, "I wonder if they use Millie," and then.
Sure enough. There
Yeah,
you go.
it was official. I was like,
Millie.
oh, I bet they. Or I'm probably, now that I've said it out loud, I was wrong. But to go back to a more serious note, I mean, not that the drinks aren't serious. Hopefully they are. Hopefully at the end of this, we'll find that we've come to some sort of Zen area in our day. But realistically, I mean, what do you think would move the needle on creating a form of value? Because what's frustrating to me is that we have either all experienced it one way or another ourselves. We know somebody we love that's experienced it. All those things that you'd think this would drive personal advocacy, right? Like, but I know even someone like myself, I don't know where to start.
Yeah.
I don't know what's
Well, it's
actual
complicated,
helpful,
right?
right? Yeah,
question.
for sure.
It's super complicated because a lot of times we're dealing with, reimbursement, what we pay people.
Right.
What do we pay people? What's it valued at? I live up near Columbus, near where the Intel plant is being built.
Yeah.
And we've created lots of opportunities to create new jobs and credentials and certificate programs. And you can go work at a plant making a chip for a car or a phone
Right.
with a certificate, and the average pay is said to be $92,000.
Jeez, Pete's.
So we're talking about how do we we value that, and it's important.
Absolutely.
But we also have to have people that can are healthy and well, and so it's part of it is everything we do is tied to what we get reimbursed for. So
Sure. It makes
and I
sense.
think everybody would say I don't think there's a person that would disagree that it's broken.
Right.
Our
So how
insurance
do
system
you
is
marry
broken.
that between the legislative side and insurance side? Because
So
that's really what you're saying,
That's-
right?
Yeah. So part of it has been we've been on a very long, slow cadence of we need enforcement of the federal parity law to say, let's make sure we're actually investigating and treating, making sure holding insurance companies accountable.
Sure.
The way to do that, though, requires individuals like you and I to complain,
Right.
not just complain to our insurance company, but to complain to like the Department of Insurance or,
Yeah.
the Department of Labor, who regulates most of the larger insurance plans, to talk to employers so that they understand, hey, I don't know that this is actually doing what I wanted it to do, and to take those next couple steps deeper, to ask more questions.
Yeah.
That's a huge. When you were talking earlier about employers, I thought they don't know.
Yeah.
They don't understand that there's another option. They're sitting down with an insurance broker. No shade on insurance brokers, but the insurance broker doesn't know. In many cases, the insurance broker doesn't even know.
I'm sure.
That's right.
And so they're sitting down trying to educate someone, and they're trying to make a living. They're going to move from one to the next.
Yep.
And so for them to be able to even take the time to say, okay, Teresa, let me talk to you a little bit about culture. What do you really want from your people? And do you realize $7,800 and $5,600, about $14,000 a year is what each employee could cost you if they're not healthy from the neck up? And oh, by the way, Mr. Employer, I know you know, because it's either you or me or somebody else in your family. And so it's education is such a huge part of that.
Oh, yeah.
Big part of it. And then, I mean, the other piece is, we've got to create career pathways because they don't exist right now. They do to some degree. A lot of times, though, young, I have teenagers. They're looking at the conversation, about how much money they're going to make as adults.
Yeah.
And real conversation. When my daughter was 14, they were doing career exploration. She sat down at the kitchen table. We're having our dinner. We're having conversation. In the middle of the conversation, she stopped and she goes, "Mom, do you know what a social worker makes?" And I start laughing. I'm like, because she has no idea what I do.
Right.
And I said, well, actually, I spend a lot of time talking about what social
I
workers
might have
and
a
people,
guess.
I might know. And she goes, "They make less than teachers. Why would anybody do that?"
Yeah.
It's like, well, okay, so let's unpack that a little bit, right? I'm like, so, teachers we value, but we still, many would say underpay for the work that they do. And they're being asked to do a lot of the work that people with mental health professional licenses do today, which is not fair to them.
Right.
Because we don't have enough of them that we can put in the schools.
Of course.
So part of it is, we've got to pay. And we know that in Ohio and across the country, Medicaid is, the largest payer of mental health services, and it covers a wider range of care. So it does not just acute, oh, you're having a crisis, but it covers long-term. And how do we support people to live healthily in their community, to have meaningful lives? And so we start there with how do we start to raise their payments, because their payments are based on an actuarial study of what it costs to deliver care. It's not your total cost, but it's got a basis.
State or it's got to be federal?
It's state, because Medicaid is a state and federal partnership, but each state drives their own policies.
Okay.
So if you've seen one state Medicaid plan, you've seen one state. So there's 50 varieties, essentially.
Oh, wow. Yeah.
They're all very similar because you have base rules, but then states can decide what they want in and not. Some states, didn't cover addiction until about 3 or 4 years ago.
It's wild to me.
Isn't that crazy?
It's crazy.
But it is. So that's, so it's all very different state to state. But that's been one of the things we've done. And like in the last budget, state budget, so we have state budgets that are passed every 2 years. We advocated for higher rates. And we were successful in getting about a 12% rate bump, which was really impactful, especially if you think about what inflation was in the last 2 years.
Last year.
Right.
That was implemented in January of 2024.
Okay.
So we just finished a study of our members to say, what did you do with salaries? And they all were able, the collective was across all positions, so administrative positions, leadership, supervisors, direct care workers, about 6% went into. But if we looked at those frontline staff, people who go to people's homes, every week, those positions, we actually saw between 7 and 9% increases.
Awesome.
Which is really great, especially since employers also worked really hard to maintain or improve their benefits because they've got to take care of the people taking care of people.
Of course. Crazy to think about.
Right. So then I do this little exercise as part of the advocacy of then I go out to Indeed.com and I look at for the same position, the same credential, not in community mental health, and what does that look like? Well, for those very frontline workers, the case managers, the people going into homes, the people running residential, we're a little better or right at where the market is. For everything else,
Yeah.
23.4% below the market. And if you're an independently licensed social worker,
That's
so a social
insane.
worker, almost 40% below the market.
Wow.
So you got a 12% bump.
And we're still
Yeah.
24% below the market.
Yeah.
They're feeling
Still
like,
not playing the game.
But
Right.
that's
Yeah.
inflation. I mean, part of that's inflation,
Sure.
right? And because there's supply and demand. So there's very limited supply and there's huge demand.
Yeah.
And that's just in what's in the available compensated employed market. That's not thinking about the biggest factor, which we know is that people are leaving to go into cash only jobs.
Yeah.
Right.
So here's the question. Why are they saying no? They're the people that you're trying to legislate to. Insurance companies, I get why they say no.
Right.
At least I think I do.
Yeah. Right. It's always follow the money trail, baby.
That's it. But when I think about why the other folks that you're trying to legislate convince, because they're all touched by it, why is it so hard to get them on board?
So I think in the last few years, they have been on board. I think we have seen growth in trying to solve a problem that, we said we would build a community mental health centers starting in 1963. It was President Kennedy who said, they created the Federally Qualified Health Centers or the Community Health Centers Act, and they created the Community Mental Health Centers Act, and they were sisters.
63.
It's 1963.
Wow.
So Governor DeWine commonly says, our system isn't broken, it was just never built. And I would say that's true.
Okay, that makes sense.
So they grew up together until we got to 1980. And it was in 1980 in the Federal Budget Act that there was a decision made, and President Reagan signed it, that health, community health, that's a federal issue. Mental health, state's issue. And they devolved that down to the states and said, each state, you take care of it.
Sure.
So we didn't have a definition of mental health anywhere in the federal government, which meant that even when people wanted to do federal funding, there wasn't any place to send it because we didn't have a common definition. So we got that common definition put back in about 6 years ago in the term of Certified Community Behavioral Health Center.
Sure.
But it's a demonstration program, so it's only temporary at this point as we're demonstrating yet again
Prove it, right?
that it works. So that's the challenge. So when you do advocacy work, you've got to stay focused on the long game.
Right. You're like, cut through the bureaucracy. There's a lot of red tape.
You're going to take 3 steps forward and 2 steps back, and then you're going to take 2 steps forward and 6 steps back.
Yeah.
But you're just constantly trying to move it forward. I think, from the legislators' perspective, they're juggling so many priorities.
Right.
Education. The funding in Ohio for education has been challenged.
Yeah.
Budgets do 3 big things, 3 big buckets. So there's Medicaid. So they medicate, they educate, and they incarcerate. Those are the 3 big things that take up the vast majority. And then everything else fits into the rest of the bucket.
Right.
And then you've had a lot of conversation around reducing state income tax. So we reduced state income tax, which means you have fewer dollars to do the same or more.
Sure.
So it becomes a priority. And then you add stigma. And even though we want to fix it, it's like, well, we've given you a little bit of money and you haven't solved the problem. That's always my favorite. Why haven't you solved the opioid epidemic? We've been giving you money for 10 years now.
Of course.
And I'm like,
we're on it, cowboy.
and I'm
Yeah,
like,
exactly. Right. Seriously.
I'm like, have we cured cancer? Because I'm pretty sure
Yeah.
we've been funding cancer research for.
You're like, I'd love us to get on any of these, realistically. Yeah, I mean, it's not funny, but it's like, you laugh. You have to laugh because I imagine just the constant absurdity of hearing this kind of thing. Because like you said, Billy, it affects everybody.
It does.
And so you'd think at some high level, someone,
Yeah.
I guess they tried in the 60s, but it's like that thing where it's like, it's funny that it's taken us, almost 60 years to get to a point where we're like, all right, we have the definition down.
That's why I wanted to dig in with you, because so if you're talking to people that are Ohio citizens, okay, what do they do? You're not going to have any argument from people in regards to the issue, right? I mean, it is what it is. We all know it. We innately know it,
Yeah.
just because of what we experience, let alone what we see. How do people support what you're doing?
So the best thing they can do is talk to their elected officials and say this is a priority. And to talk to their employers and say this is a priority. For employers, because employers many times spend more time with our elected officials, they care about businesses.
Yeah.
They don't think about what I do as a business.
Of course
I'm a
not.
business.
Yeah.
My members employ I looked at this up today, 35,000 people just in my membership.
Out of
Whoa.
175.
35,000
That's
people.
incredible.
That's huge,
That's
yeah.
a big number.
So it's how do we start to have those conversations and say this matters, this is a priority for me.
Yeah.
Even if it's not your top priority, it's my number 2 priority.
Yeah.
And many times what we hear from like the Chamber of Commerce and from businesses is they've got whatever's their top issue. But number 2 is always like, I need healthy people.
Right.
You know, Governor DeWine, when he introduced his budget, they asked him a question about tax cuts because we're always talking about cutting taxes. And he's like, I never have businesses coming in asking me for tax cuts. What they're asking me is, do I have a healthy workforce? Do I have an available workforce?
Yeah.
So how do we start to flip that narrative? We need a healthy workforce. I need to be able to come to work and not worry about my kid or my aging parents or this or that.
Yeah.
And your answer to that is you have to make the services available.
Got to make services available. You got to pay people. We've got to
Right.
have a career path. You know, I need to be able to bring people into this work before they have a master's degree.
Yeah.
I can do it on the substance use side. I still don't have that pathway on the mental health side. So that's something I'm working on.
Yeah, so people that are actually doing it now, are there studies of the question being asked, why'd you choose it? And the reason I ask that is I'm thinking, okay, if this was their motivation for getting in to serve, how do you identify others? And I understand the problem. They need to be paid more money.
Sure.
Right.
But is there any studies on that? Like, why are you doing this? Why'd you choose to do it?
I mean, many times it's because you want to make a difference. I mean,
Yeah.
people who intrinsically, you know,
Be my guess. Yeah.
you know, they want to make a difference. They want to, and so it's usually typically anybody in healthcare. You know, we have this kind of super crisis in behavioral health, but we have a healthcare shortage.
Sure. I mean,
Period.
across the board. Yeah.
You know,
Absolutely.
nursing, physicians, you know, psychiatrists, OBGYNs. There are massive shortages. And so because it's really hard work anymore.
Right.
And you're not as valued. I mean, even in what, you know, you look at what primary care physicians make, what OBGYNs make. Something I didn't realize till a couple years ago when I was looking at a study on, and this was in physicians, the gender bias.
Oh, sure.
That more and more physicians, the lowest paid physicians, are now predominantly female. OBGYN, family practice, pediatrics, and even psychiatry is now 50-50. Wow. The highest paid medical professions, cardiology and orthopedics, are 90% male. And so there's a study, and part of it is, you know, there are periods of time where women are out of the workforce many times because they're having children.
Sure.
And so, but that's also something that is playing into, you know, some of the values that we have and
Sure.
the valuation of careers in these fields. And so how do we, you know, also think about that in part of the conversation, because that's part of the bias that we deal with.
Yeah,
And
absolutely.
And it's real. And
Right.
I'd say the same for teachers and, you know, nursing and some of the other professions that we typically struggle, you know, to find pay.
So, Teresa, when you do, one of the things your organization does is you guys will have, how many conferences a year will you bring all these organizations together?
We do one large conference a year, and then we do another event usually for senior leaders. So 2 a year, and then we'll do other things that are more technical in nature around, you know, either the business world that we live in or the compliance world we live in, because we're heavily regulated, and
Right.
you know, we're always making sure we're good stewards of taxpayer dollars.
Of course.
And you know, or we'll do something on the clinical side. Just kind of depends on where things are.
So when you were talking about employers being able to be educated so that they can understand the actual impact?
Yep.
How do they get behind those conferences to say, okay, I hear what she's saying, I see what they're doing, I listened to what she said.
Right.
How do they get behind it?
Give me a call.
I'm flashing her
seriously.
number on screen right now.
Hey,
Call the hotline. I mean, but
There you
it
go,
is
seriously.
seriously that easy.
I mean,
Or at least to get the
certainly,
ball rolling.
The bigger thing is really at the local level is talking to their legislators.
Okay.
We've been talking among our membership that the vast majority of my members are nonprofits. So they all have boards of directors or boards of trustees. And many of them are business leaders in their community.
Sure.
And it's like, I need you to educate them to also be your spokesperson.
Sure. Okay.
When they attend, an event where there's a legislator, when you're at the 4th of July festival, when you're meeting people, say, hey, this is important to me.
Yeah.
Because that's how we raise the value and we elevate and impress upon this is how we do it. It's hard, though, when you're the legislator with a million priorities in
they
front
got
of
a
you.
lot on their plate, don't they?
To make that decision. So, we've been very fortunate in the last probably 8-10 years because we've done a good job and because everybody's impacted.
Sure.
The opiate epidemic, brought it all to light. Right?
Yeah.
And the mental health issues have been there, for a long time.
Yeah.
The statistic that's not talked about is the number of people dying from excessive alcohol.
Really? And why do you think it's not being talked about?
Because alcohol's legal.
Right. I've assumed that was the answer.
You're going
but,
to touch that? You talk about a battle.
right.
But it's killing
You know?
people at rates that are 150% of opiates.
Oh, that doesn't surprise me, unfortunately.
Not at all.
Because, I mean, like, it kind of comes back to the point of access, right?
That's
I
right.
can get that very easily, right? Like, the opiates, I'm sure I could get that easily too, but I can't go to, now I'm like, I probably could get that at Speedway, but you know what I'm getting at. It's like I can go to the gas station, right? But it's like, you know what I mean?
You'd be all right at Speedway.
Yeah, I feel like Speedway is definitely the one. I was like, what's a nicer gas station? But you get my point, right? It's like, it's really ingrained in our culture in a way no other substance really seems to be. I mean, look what we did with cigarettes, right? You know what I mean? They went away so quickly. Always flexing back on you. I love this. We're in the fishbowl right now.
Yes.
Every so often the kids will be in there, and we love it. I'll let Billy do his thing. Oh my god, this is a good podcast.
This is, yes.
I'm sorry.
Lucky. I'm a little sleepy today.
That was good. I know. I normally jump through the glass.
Yes, I would.
That's why we have the extra glass doors just in case. I tell
right-
Jungle
that's right,
first. I was
put
like, Billy's here. He goes, get the glass. But all kidding aside, no, I think that access thing has got to be weird. And again, with it being so ingrained in our culture and everything, that I imagine it's a bummer to me that those statistics get buried because it's not like, some people still want to use it. They're going I think that's like the through line always. It's like whatever people want, they'll get access to and they'll do it no matter what. Can we help them, from this issue, right? In the first place. But I think with alcohol being so ingrained in culture, it just bums me out. To hear that kind of thing where they're like, oh, we're not really even reporting on this. I'm like,
Yeah.
well, we probably should. You know what I mean?
Yeah.
But we don't talk about it.
Right.
I mean, we know the data is
Yeah.
there, but we don't talk about it as something because it's just, you're right, it's absolutely ingrained in our culture.
Yeah. You're like, oh, that's just how it is.
It's a rite of passage.
It really is, yeah.
It's a sign of sophistication.
Yep.
It's not something that for some people is, biologically very dangerous.
Oh, yeah. To put it mildly,
Yeah.
I mean,
Yes, to put it
again, another one of those things that I'm like, I bet we all either know someone that we love or it's in our family. Not to say that we don't love them, but you know what I'm saying? Like, there's someone close to all of us that is struggling with this, and it may even be us, That's wild to hear. And I didn't think the number would be that high, but to hear that, you said 150% of what you're seeing from opiate deaths, right? That's wild to me.
Yeah, so we've brought opiate deaths down in Ohio to a little over 4,000, 4,100, and that's down more than almost every other state in the country. But are
from
excessive.
where, Teresa?
We were at close to 4,900 deaths
Yeah.
a year ago. So in a year,
20%, right?
That's amazing.
and then, but excessive alcohol deaths was, I believe, around 6,700. Wow, almost 6,800.
Crazy.
I
So,
wonder how many of those are.
And that's what's reported.
Right.
Which means it was
Yeah.
documented as cirrhosis or related to alcohol, chronic alcohol use.
Yeah.
Unreal.
Yeah, it is. I was wondering, before you said cirrhosis, I was thinking how much of that is young people. When I think about somebody dying from drinking alcohol, I was thinking about an immediate
acute intoxication.
Yeah.
Right.
But, cirrhosis, obviously, different story. That's a long time.
Yeah, sobering thought. Pardon the expression. But
Was that intentional?
that one was.
Okay, that's what I thought.
It's terrible though. No, it's like a bummer to grow up during all of this. You know what I mean? And I'm just like watching these kind of things.
We're here,
just kind
bro.
of,
We're gonna fight.
I know.
We're
I'm
gonna
ready.
Fight.
I'm
this
so
lady's
ready for
fighting.
it.
She needs some help.
Yeah. But
So-
what can I mean, obviously having you come on the show and talk about this and broadcasting this kind of thing, which is why I always love when Billy brings people like yourself around. I'm like, cool, I love this.
Yeah.
And thank you. And speaking of access, someone I wouldn't have thought I might have access to originally. So also thank you, Teresa, for coming down and doing this. Yeah, I mean, like, what are those things? I know we kind of touched on this, but it's like, I guess it is just as simple as like reaching out to your local legislator.
See, even then, though, Teresa, like trying to drill down on that, okay? So
Yeah.
you reach out. They heard some of what you said. How do you impact? What do you say?
Right.
How do you actually make an impact? I mean, that sounds good. Reach out. What do you reach out and say?
Yeah.
What do you do?
Make sure you prioritize funding for mental health services.
Prioritize funding for mental health services.
I think that's a good,
to the point.
something I think about all the time because I have a lot of friends that I will call this a form of anxiety, but like they're like afraid to make phone calls. I don't know how to say that. I don't mean it mean.
It's fear.
But you know what I mean?
It's not.
Well, this generation in particular,
Right,
the younger
so-
generation doesn't know how to talk on the phone.
That's really where I'm getting at. And so it's like this weird thing. I was in this group recently. I mean, I'm not even old. I'm like 41, dude. Like, it's not, I'm not
You're
like
a
some
baby.
old man. Yeah, exactly. And I'm sitting there going like, I had no idea how much power I had just by being like,
Yeah.
hello, what hours do you have today, store? Right?
Right.
But a lot of people be too afraid to do that. And what I've been seeing a lot around a lot of different forms of advocacy now are people putting out scripts for people. So even, just having a line of dialogue to be like, what do I say when I call?
Yeah.
Well, you just say, prioritize this funding,
That's
please.
a great point. That's a great point.
So it's like
There's gotta
anything
be
we can do.
something motivating to get them to do something that they're fearful of doing in the first place.
Well, I'm hoping, I'm sorry to get like a little annoyed by this, but I'm like, how long are we going to let this all affect all of us before we're willing to just be like, I don't want to make a phone call, but I would like to be mad that it's happening. I'm like, where's the line for you as people?
Well,
I'm
too
looking
many-
directly at them.
And too many times, we're angry when we're in the midst of a crisis.
Right.
And then we don't know what to do.
Sure.
And we're waiting, it's me or a loved one and I'm sitting in an emergency room, or worse, I'm sitting outside a jail
Yeah.
because my loved one has been arrested.
Sure.
And because we don't have access, what we find is a lot of the folks end up, and they can't get the care they need, they end up in a jail somewhere.
Right.
And so our jails and prisons have become the new state hospitals.
Of course.
And so now we're treating them, and they have a criminal record.
Yeah.
I got an idea. Let's take somebody in crisis and traumatize them.
Yeah.
Yeah.
Let's see what happens.
Yeah, you're like, this will be good, and then we'll just release him back into the wild one day. This will be
Right,
fine. Like,
right.
this can't be detrimental.
And then you start, then you turn on the news and you start watching things that happen and you wonder why. I mean, there's your motivation. What you're doing by investing into organizations that are on the front lines
Yep.
is setting the groundwork for your kids and your grandkids' future.
Yeah. I mean, what's
in all reality, I mean, that's
this comes back to a bigger thing I see too, which is that I worry that not enough people see the big picture of all of us and are very, very, even like nice people are very focused on how does this benefit me directly? And we'll kind of wash our hands of a lot of things, right? And so it is that thing where, the struggle I see often in life and what I'm always trying to get involved in is like, how do I get people just to care about anything beyond their like somewhat limited purview, right? I think about the people I grew up with around here who I'm just like, yeah, you're gonna like live and die in the same house that like your grandparents and their parents lived in, and so like I worry that there's not enough people with that kind of big picture view of the world, which is like, hey, sometimes you got to do some stuff to help other people. It might feel like in the short throw, like you're putting a little more effort in than others, but the thing is, it should pay dividends long term. At least that's how I view things. Or I'm like, every little bit of kindness or advocacy that you jump in on it's going to drive that change a little bit, even if it's 1%.
Yeah.
This is how I'm starting my book, where I'm like, even 1% is enough that counts. Well, in either
Huge.
direction.
I mean, 1% would be huge.
I think about that, and then it's like, oh, and then if a bunch of people see a bunch of people doing that 1% of effort, they're like, oh, well, so it's not that big of a deal. And then we keep pushing, then the ball's rolling, and well, you know what happens when you push a rock down a hill,
Sure.
You get in trouble with your mom later because she said, don't do that. But no, I mean, seriously, I think that's the thing I keep kind of coming back to too. It's like,
Giving everybody permission to talk about it. What I love about the younger generation, like I said, I have teenagers.
Of course.
They talk about this stuff.
Yeah.
All the time.
Yeah.
It's on TikTok all the time.
I love it.
For good or bad.
Sure.
And a lot of it is not good.
Right.
But this younger generation has a very different approach to recognizing and talking about it.
Yeah.
They're just not in the voting block yet, and they haven't found their power.
Right. But
I think it's coming.
Yeah.
And I think that's, there is part of a shift that still has to happen.
Absolutely.
Around, it's not, mental health and substance use are real health conditions.
Mm-hmm.
They're not moral failings.
Right.
You can't just pray
So
your
well
way out of
said.
it. You can't just stop your way, stop doing whatever your
Right.
way out of it. All of those things value.
You made a really strong statement when you said I don't know if you said mental illness or crisis, the issues that people have is biologically
There's a biological
related.
component.
There's a biological component to everyone.
Brain chemistry.
yeah.
Yeah, and that's a very powerful statement.
But not everybody believes that.
Well, what's so
They
frustrating
don't.
is I feel like I've
Or
heard
they
that
don't know.
I've heard that since I was like in my teens.
Yeah.
I remember being like, hey, substance abuse and addiction, that is an illness. It's not just, it's not just this like.
You're self-medicating, right?
Yeah, and I imagine for a long time we all just thought it was like sort of but like in a loose sense where you're like, well, they're just, they just can't stop themselves or whatever it is. And it's like, sure, that's a little bit true, but it's like the importance and the nuance there where you're like, this is like any other illness. You can't just
right. It's
hope it
dopamine.
stops.
It's dopamine receptors.
Yeah.
It's serotonin receptors.
Yeah.
It's
all things we
there's all
pretend
these
don't
things
exist.
that are in your brain.
But look at this whole industry of
Right.
beverages that cater to. I'm sorry to get a little loud now, but I just get so worked up
Get
about it. Where I'm
loud,
like,
man.
well, no, yeah, because like we have a whole industry around all of these things, and I'm always worried that due to the nature of existence, that people are more concerned with putting a Band-Aid on a problem because, and I see that all the time versus ever looking at the stem of it. So I am happy with the younger generation that they are at least having
Are any
these
of these
conversations.
Ohio companies?
Maybe Elixir is. Let me look. Nope, they're Minnesota. Maybe we need Billy. This is how we start our next thing. New York. And where's Kin from?
Well, Ohio's got to have a company, right?
I think
I got an idea, man.
Texas.
I'm
Let's
pretty
go.
sure they do.
I got an idea. Yeah, I'm sure they've got. Yeah, I'm sure they've got plenty.
Well, because we now know that there's danger with alcohol, we're creating all these non-alcoholic beverages that still taste like alcohol.
Right. That's a weird one to me. That one didn't make that much sense to me, but I'm cool with
They
it.
take a percentage, put it in their budget of what they provide to go back to the agencies that are creating.
So let's talk about that.
Let's go.
I
Let's
love it.
go.
Yeah, fire,
I like
fire lit.
So let's talk about this for a second. So Ohio just passed adult use cannabis, right?
Right.
So we have recreational marijuana available.
Yep.
Initiated statute, so it's statutory language, which means the General Assembly, we could change the law. When it was passed, it's a 10% tax. You can argue whether that's good or bad. You can argue whether adult use cannabis is good or bad. Lots of
10%
opinions.
tax to state.
10% tax to the state, and then 25% of that tax is supposed to go to the Department of Mental Health and Addiction Services to fund substance use prevention and treatment.
Love that, but I'm assuming it's not happening the way it's supposed
You talk
to.
about an
So-
oxymoron.
Right?
Do you know what you just said?
I do.
Okay.
I
'Cause
do.
That's nuts.
So this is all,
we're gonna.
but we're taxing it, which, sin tax is a
Right.
thing.
Yeah.
We fund education with sin tax on alcohol and
Sure.
gambling.
Yep.
And the governor's proposed budget increases sin taxes to cover a lot of the additional spending that we want to do because there is a movement to say income tax are bad. And now we've got property taxes that are out of control by many people's opinions. And it's like, well, let's talk about that. We reduce state taxes. We have a local control. So now you have all the locals that have to still pay the same services that we expect. It's got to come from somewhere, right?
Right.
So this particular tax on adult use cannabis, there's already been bills introduced that would take the money and just put it in the general fund so that the General Assembly could distribute it wherever they feel, which doesn't mean it's coming
Right.
to treat the very people who will likely become addicted as the result of using recreational marijuana. And so so that's actually one of the things we're doing, as crazy as it is I'm protecting that the 25% of that tax, whatever it is, 10%, 15%, or 20%, those are the numbers on the table,
Right.
comes to still make sure that we can provide services. We're actually looking in the governor's proposed budget that it would fund 988. 988's a new thing, right?
Yeah.
911, we know what 911 is.
Right.
If you need if you have an emergency, you call 911. Now, if you have a mental health crisis or a substance use crisis, you can call 988, and you have somebody available 24 hours a day who can help you, because we don't want people dying from suicide or overdose. So let's get them connected and get them triaged to the right place where they can get the right amount of help. So we're kind of depending on these dollars to fund some of these things.
So
that's a real thing.
Have they started to flow?
Sort of, yes.
And that's dictated.
So that was the statute that we passed. Was it 25% of whatever the tax is comes to the Department of Mental Health and Addiction Services. Yeah. But we know there are lots of people who would like to see those dollars sent elsewhere.
Sure.
Let's fund education with them. Let's fund jail services with them. Let's fund services over here. And I'm like,
but statutorily they cannot.
Right now, but a budget bill is legislation and they can make changes to it.
Okay.
So the voters said, we approve with this. And we're saying, okay.
So now it's up to us to educate the voters to be like, hey, maybe don't mess with these.
Just make sure the money, don't take my money.
I mean,
don't steal my money.
Yeah. And I love the idea of these things funding other, I mean, not that it's not a wholesome activity, but you know what I'm trying to say? Like, I love the idea that it would come, like the money that I would spend on buying from a dispensary here. I'm like, well, not only do I get something fun for me, but I'm also speaking with my wallet in a way that matters to help people that are struggling, and potentially me one day if I, you know what I mean? Realistically, I think that's the thing that I get maybe the most upset by is I'm like, yeah, right now you don't need help, but one day you're gonna. And maybe it's because I spent my life in and out of hospitals and dealing with the handicap that I just think about that way more frequently, where I'm like, yeah, I'm going to need help. I mean, even in my personal relationships, I'm just like, you love me? Do you love me carrying me up and down a flight of stairs? Love me, or do you just like me right now?
Yeah.
That's right.
I mean, that's a real thing I think about all the time.
Yes.
And the answer is most of them don't love me walk up down the stairs.
I mean, unfortunately, that's true.
But that's true. So when I think about this stuff too, where again, the mental health aspect of that is so important in all of these fronts, where it's just like, I just don't know how it's frustrating to see people be so short-sighted at times, you know? Because I'm like, not that I have it all figured out, but I feel pretty close.
I don't think we arrive at that ever, right? But
Well,
at least you've got, you understand the power of being vulnerable. You understand, and you've got people in your life that you can talk to, process with. Which,
a lot of them don't want to hear it. That's why I do so much of it on this microphone. I'm like, all right, soapbox time, you know?
Let them have it, baby.
Yeah, baby. Hey, I'm ready to share. Like, look, this is how we get people fired up. I'm hoping that, I always hope, I'm like, maybe someone will see me being annoyed and passionate about this and go, oh, damn, that's something I never really thought about.
Yeah.
Oh, I might need help one day.
Yeah.
Maybe I need help right now.
Isn't that the case, though? Any one of us is one chronic health condition or one accident from needing all of these services.
I fell down a flight of stairs this summer, and I was pretty much trapped alone in my house because of it. If you don't think that affected who I was, at least in the short term even, and I'm sure, watch me walk past a flight of stairs, you'll see it definitely affected me long term, as silly as that sounds. But it's like that thing where I'm like, that's a mild one, right? You know what I mean? And I imagine everybody's going through this all the time. I feel like a tough person.
And it's time limited. You're going to heal. In 6 to 8 weeks, you're going to get back
to some semblance of normal,
of what was normal for your life.
Yeah.
But think about our older population, our seniors.
Of course.
Loneliness and isolation are terrible.
Awful.
We're seeing.
You said COVID just exacerbated.
Absolutely. But we also know that we're seeing higher rates of substance misuse in our older adult population. We've seen suicide rates in men over the age of 70 as one of the growing areas. So we have, and it's, and that population is getting bigger every year. We add 500,000 Ohioans every year to that older age population.
Wow. Yeah, it's
How many
great. And
people
it's just
in
going
the
to keep.
state? 10 million, 12 million?
11.8 million.
12 million people.
So, and we're an aging state now. I mean,
So you're telling me, let me do this. So 12 million people, and what I read in 23 was 42 or 43% of them were dealing with anxiety and depression. 20 some odd percent were diagnosed with a mental illness.
Yep.
So
We don't
what
have
is
enough
that?
people caring for people.
is that 4.8 million people
Feels
dealing
like it.
with?
Around that.
I mean, that's crazy. That's a crazy number.
It's an insane number. And those numbers are just going to grow exponentially over time. Like, I mean, look at population rates. Like, so it's just going to be a bigger number every year.
This is the last graduating class that they start getting smaller after this year.
Really?
It's a new number I didn't know. I
Huh,
learned that
interesting.
one
Wow.
recently. This
That is very
we are at the
interesting.
pinnacle.
Is that right?
Standing on the
That's-
precipice.
What's that?
Except we're just standing on the precipice.
Yeah?
Yep.
That's really interesting. Well, Teresa,
It's amazing.
I'm so proud of you.
Yeah, this is an amazing
seriously,
episode.
I mean, you talk about standing in the gap. I mean, I can't imagine how rewarding it is, but I am so proud of you and so happy to have you here with us.
Thanks for the invite.
Of course, oh my gosh, my
of
pleasure,
course.
yeah.
And yeah, I mean, the encouragement is step in and figure out how you can come alongside what you're doing from a legislative advocacy standpoint.
Find your local mental health agency. There's lots of community mental health centers. There's one in every community across the state of Ohio.
Is there an easy way to find that online, I'm assuming?
Wouldn't it be nice if there was? We're actually working on that.
Oh,
We're
cool.
actually
Yeah.
working with a group at the state through the governor's office, Recovery Ohio, to actually use AI to go out and
Imagine that, huh?
do kind of a calling and create a portal to where you and I, when we need help, can easily find a legitimate source.
Oh, I love that.
So that because finding directories and where you can go, it's hard because once you publish something, it's stale.
Sure.
Because organizations move, people leave, things change. So how do we harness technology to do that?
Yeah, it would benefit us. Yeah, I love
you-
that.
Certainly, you can visit my website. I've got a list of my 175 members. They
Your
cover
website.
is theohiocouncil.org.
Perfect. Easy enough.
Yep. And
Short and sweet.
Short and sweet.
And there are, I know several organizations down here that are part
Absolutely.
of your council that are, one's right over Child Focus, I think it is.
Child Focus.
Child Focus right by Jungle's Place in Eastgate.
Oh, perfect.
And I think she told me they touch 20,000 families.
Yep, I believe that's right.
20,000 families, and it's mostly Claremont County, I think.
Yep.
That's amazing.
Yeah.
I mean, again, it's like
New Path Family and Development.
Sure.
Just moved to the Norwood area.
Yep.
Thousands of families touched. I don't know their exact number, but thousands and thousands of families touched every.
Got Best Point, Talbert House.
Oh, right, Talbert House, of course.
Greater Cincinnati Behavioral Health,
Yep.
Butler Behavioral Health. I'm sure I'm forgetting somebody that's
Of course.
down here.
Yeah.
But
They can
those are
double
just,
check it on the website.
they can look it up on the website.
You're amazing.
Thank you.
You did a great
Yeah,
job.
this is really
just
informative and
absolutely-
very
I
cool.
can't believe what you've got up here.
Yeah, and I didn't have any notes or anything. Just
Yeah,
Went
see?
just as well as we thought it would, though.
And
I
then-
thought it was
And
good.
then some. I mean, it's amazing.
We knew. We were like, we'll let her talk.
Yeah, exactly. I'm never this quiet.
this is true.
Yes, but that is yeah, I mean, it's staggering. I mean, you sit there and you listen, and it's just staggering. I still, though, can't put my, it's like.
None
I
of
wanna
us
move,
can.
Yeah, it's like, okay, how do we move this into action? How do we change? How do you go support Eric? How do you go support Pam? How do we do that through, because you've got the right idea, right? You've got all those $35,000 people, okay, we got a common spot to go here. It's the Ohio Council. So how do we help them through helping you?
And part of it's just it's every one of us being willing to stand up and say,
Yeah.
this is important to me.
Yeah.
And I need you to do this. And when you go to the ballot box, no. Does this person support that? Is it going to be the number one thing that people vote on? Maybe not.
No, but it should be
I'd
up
love
there.
it to be there.
I'd like it to at least be on the Mount Rushmore of things they're voting for. Top 4. I mean, seriously, I know I try to keep it a little light here, but it's
This was as
it's
heavy
the
as we
engine.
get.
I mean, it's the driving.
This was as
pretty
heavy
deep.
as we get.
Yeah,
This is
well, I
deep
just
stuff.
keep thinking, I'm like, this is the driving force behind everything that we all do. Every single person, if you're in good shape and physical, mental, all of those things, you will perform at everything better. I mean, it's as simple as how many times do I have to have people tell me, get at least 7 hours of sleep if you want to perform well tomorrow? Okay,
A night
cool,
or
that's on the
a
list.
night?
Yeah,
In a
no, just
week?
before I'm dead.
I'd like to know how to do it.
No, you know what I mean? I'm like a combined 7 hours.
Yeah.
No, again, I keep getting on the soapbox, but it's one of those frustrating things.
Dude,
but,
you're amazing.
You are too, Billy.
You're
Thank
amazing.
you.
Thanks
for
for
bringing me great guests. Love that for us. And
Yeah.
thank you, Teresa.
Absolutely.
Really had a
Yeah.
great time learning
Yeah.
with
It's
you
been fun.
today. Yeah.
It's been fun.
We got a little high
back to
fives.
Columbus. You
Back-
going
That's
back
right.
tonight?
Oh, heck yeah.
Oh, love that.
She's got babies. She's got to go.
She got babies? Well, here, let me do my sign off. In the meantime, huge thanks to Billy. He's exiting already. I'm about to follow suit,
you wanna
baby.
know why?
You're going to come high five me?
No, well, yeah. High five you. Hug you.
I got
I'll
it.
carry you up the stairs.
Oh, my gosh.
You
That's
need-
the person that loves me that much.
Yeah.
Love that
No,
for us.
It's either that or no.
No, not here. I was going to say I'll follow suit. Well, on that one, I will let you do it. Advocate for mental health. We heard how to do it here. Call your legislators. Say all kinds of lovely things. Simply just tell them that this is important to you. You don't need a script. And if you really need a script, send me an email, and I'll try to figure something out, and I will try to help you out. Podcast@junglejims.com. In the meantime, thank you so much for watching the show. Thanks for learning with us. And in the meantime, we'll see you out there in the aisles.
The Jungle Gyms podcast is recorded in the WJJI studio inside Jungle Gyms International Market in Fairfield, Ohio. The Jungle Gyms podcast is produced and hosted by Mark Borison.